Hello, my name is JT Ramos, and today I will be demonstrating proper hand washing techniques. Improper hand washing techniques is the number one cause of spreading infections in hospitals. Those who are most susceptible to getting infected due to improper hand washing techniques are newborns, patients with HIV due to their lowered immune system, and patients with open sores. There are two ways to perform hand washing techniques, that is using hand sanitizer and using soap and water. If you come into contact with a patient who currently has C. diff or MRSA, or your hands are visibly soiled, you definitely want to wash your hands with soap and water. But with hand sanitizer, the way we do that is get some hand sanitizer in your hand and just rub it in your hands. Rub it all over your hands for 15 to 20 seconds, and then you just let it air dry. That's how you would use hand sanitizer. But today I'm going to show you how to wash your hands using soap and water in a sink. So before you go to the sink, you want to make sure you have all your supplies, so soap, water obviously, and paper towels. So when you walk up to your sink, you want to make sure that you stand away from it, so your clothes don't touch the sink in any way, or else your clothes will be contaminated. And then when you turn it on, you just want to have a steady flow. You don't want it to be too strong or too hot. But before you do that, you want to ensure that you take off all your jewelry and any rings, watches that you may be wearing, because they may carry bacteria. So just want to make sure you take those off. So turn the water on. Not that strong, but about like that. So then you want to get your hands nice and wet. Remember, don't want the water to be too hot or else you burn yourself. Nice and wet. Get some soap. We're going to get a lot so you can get a good lather. So you want to wash your hands for 15 to 20 seconds. Make sure you get in between your fingers. Between your fingers, the tops of your hands. Make sure you get your wrists. And then your nails and your cuticles. Make sure you try to get everywhere. So you want to wash your hands for 15 to 20 seconds, or singing the happy birthday song twice. So after you wash your hands for 15 to 20 seconds, you want to go ahead and rinse. Turn the water on. You want to get your from tips all the way back. So just and try not to splash. Try not to touch the sink, or else you'll contaminate yourself again.
You're going to try to make sure the glove is over.
After you rinse your hands, you want to just let it drop. Keep your hands up. Just let it drop. You don't want to shake your hands, or else you'll spray water and you'll contaminate yourself again. Then grab some paper towels. And then you want to pat your hands dry. I just want to make sure that your hands all the way dry. And you can go ahead and throw this away. I'm using a sink that has a pedal on it, which controls the waters, like your press down right here. But if you had a sink that had handles, in order to turn off the water, you would grab another paper towel and then use this to turn off the handle so that you don't contaminate your hands again. And then you would just throw this away. And that's how you perform proper hand washing techniques.